Okay, so I see many of our participants looks like have joined us. We have a lot of volunteers joining us today, so we appreciate you taking the time to do so. As is normal protocol right now, have to put our masks on when we're in the hospital and when we're out in the community. So this is my mask. I'm happy today because we're with our volunteers today. So thank you for joining us. So good morning. I'm Christy Brown. I'm the Senior Director of Volunteer Engagement for WellSpan. First, I want to thank all of you, our volunteers. We miss you and we hope you're doing well. We value each of you. Thank you for taking the time to join us for this webinar today. We felt it was important to share updates with you to keep you informed on what's happening within WellSpan. We begin with updates regarding WellSpan's COVID-19 response from Dr. Mark Godecker, Vice President and Regional Medical Director. Then Maria Royce, our Senior Vice President and Chief Strategy Officer, will talk about what's happening in our communities and how WellSpan is working to lead our neighbors through this challenging time. Kristen Voigt will give an update from philanthropy, and I'll wrap up with some updates that cover details more relevant to your efforts as volunteers. I think you'll hear in our comments today that while we are seeing really good news in flattening of the curve, it's important to remain vigilant in the coming months. As a community, we'll move through new decisions and new phases of resuming new day-to-day routines. This will require us to maintain a high level of safety to continue protecting ourselves and others. Before beginning with our first speaker, I want to acknowledge the unwavering perseverance of our frontline heroes within WellSpan and throughout the community, our skilled nursing facility colleagues, first responders, community groups serving vulnerable populations, and so many others. We are grateful for their dedication and compassion as they fight COVID-19 for you, for me, and for all. On behalf of WellSpan, I would also like to thank all of you, our volunteers, for your continued support and talents. Again, thank you so much for all that you do for WellSpan and our patients and for joining us today. Dr. Godecker, I'll turn it over to you.
All right, thank you, Christy. And just so everybody knows, I am at home right now, working from home, trying to create social distancing. But if you see a dog or a child run behind me, that's my family. They're supposed to be there. So as Christy said, I'm Dr. Mark Godecker. I'm the Vice President and Regional Medical Director with the WellSpan Medical Group, and I'm a practicing family physician in the York area. First, let me say I couldn't be more impressed by our communities for how we're all pulling together to support one another across central Pennsylvania. This really has been an exceptionally challenging time, but within WellSpan and out in our community, people are truly rising to the challenge, and it's greatly appreciated. Today, I want to share with you a few updates on WellSpan's response to COVID-19. We continue to be in regular communication with the Centers for Disease Control and the Pennsylvania Department of Health to ensure we're following the most current guidelines, and that's very important for us to stay up to date. We are seeing good news nationally and locally that social distancing is helping slow the spread of COVID-19 cases. We encourage anyone who believes they may need to be tested to first to be screened from home, either by web or by phone. You can go to wellspan.org and use our coronavirus assessment tool to determine if testing is necessary. So far, more than 17,000 people have used the tool to date. We also offer a toll-free hotline. That phone number is 855-851-3641. Let me repeat. It's 855-851-3641. And that hotline is staffed by nurses that can answer any questions that you might have regarding COVID-19 or testing. It's important that anyone who needs testing first, they should be assessed by phone or by web, or they should call their primary care provider first. We recently developed an online platform that provides local data about our COVID-19 testing and patient care locations at wellspan.org/coronavirus. It is important to rely on the Pennsylvania Department of Health for more detailed data. We share our results with the Department of Health, and they are a trusted source for accurate information. Their website is health.pa.gov. Our COVID-19 information dashboard, which is, if you have not seen it, I would encourage all of you to go out to the website to take a look at it, provides daily updates regarding testing, patient cases across our health system and within each of our counties we serve. It is our hope that the data will reinforce the need for our entire community to remain vigilant and to continue efforts to slow the spread of this disease, especially as we start to return to work. I think the key here is that data is our friend as we move forward and making sure we have the right knowledge. As you will see from this website, we have completed more than 21,000 tests for COVID-19, and this is within WellSpan specifically. And this has been since mid-March, and about 2,100 patients have tested positive. So it's about 10%. The overwhelming majority of these patients are recovering at home or have recovered. There are a small percentage of these patients that have needed treatment at our hospitals. Many have asked about test availability and supply, and currently we do have adequate supply for testing. We continue to monitor that very closely. Regarding hospitalized patients, the number of COVID positive cases in our 8 WellSpan hospitals is currently 59, with another 9 suspected cases. This means our system is not overwhelmed. Our response plans include the ability to move resources to where they are needed within our system. As we look to the future, we remain prepared to respond to a surge if it does occur. To protect patients, WellSpan has taken the following measures within our hospitals. We have dedicated COVID-19 patient care areas, and this is both inpatient and outpatient. Patients who have tested positive or those who are showing symptoms of COVID-19 are isolated to specific treatment areas. Those patients are treated by a care team assigned to only COVID-19 patients. We have limited entry points at all of our hospitals. All staff, patients, and visitors will enter the hospital at designated entry points where they will be screened prior to entering. And this is also occurring at our outpatient locations. Staff who screen positive are evaluated by our employee health department before they can return to work. We have visitor restrictions in place, and these I know have been difficult at times, but they are very, very important. By limiting visitation to specific types of patients, we can maintain social distancing and we help prevent exposure to COVID-19. All staff members working in COVID-19 care areas, screening areas, and emergency departments are required to wear personal protective equipment. That's also known as PPE, if you've heard that term, including masks, gloves, gowns, and eye protection. Our staff are trained in the proper use of PPE, which is very important. All hospital staff are now required to wear the appropriate mask during their shift. And this also includes our outpatient locations. And our patients are also encouraged to wear face coverings to prevent any spread of COVID-19 within our hospitals or any of our care locations. Focused education efforts are underway, not only by WellSpan, but on a national level to address the groups that are most vulnerable to contracting the virus. The most critically ill COVID-19 patients at WellSpan's hospital may qualify for an investigational treatment using convalescent plasma. And if you haven't seen anything about this, this is really a neat program that we are participating in that's really helping patients. As part of the FDA's expanded access program through the Mayo Clinic, WellSpan physicians have started to offer this new treatment to COVID-19 patients. We've used this investigational treatment for some of the sickest COVID-19 patients at WellSpan Good Samaritan Hospital, WellSpan Ephrata Community Hospital, WellSpan Chambersburg Hospital, and WellSpan York Hospital. Only those patients who are critically ill and hospitalized qualify for convalescent plasma treatment. To date, we have treated more than 30 patients. Many of you I know are interested in this program and interested in helping out and donating. For those who have recovered from COVID-19 and are symptom-free for 28 days, they are eligible to donate plasma to help others. The key here is you must have had a positive COVID-19 test when you had the disease to be eligible to donate. There is more information on how to donate and who is eligible on our website at wellspan.org. The good news is that our region has not been hit as hard as other areas in Pennsylvania, such as Philadelphia and Montgomery County. However, caution is advised. Based on forecasting models developed collaboratively with the University of Pennsylvania, a bump in cases is possible in June and yet again in the winter during our annual flu season. That means our region is still categorized as being an active community spread. I think the key here is we don't want to let our guard down just yet. As we look to return to work and reestablish pre-COVID-19 social interaction, it's wise to consider that our current data showcases the spread of this disease during aggressive social distancing efforts. It remains unknown how these figures would have looked if we didn't take these precautions. Once again, we are seeing the effects of our aggressive social distancing right now, and we don't know what would have happened if we did not have this in place. As an organization, WellSpan is continuing to provide care in safe ways and is practicing social distancing where possible. By leveraging technology, we've accelerated many of our telehealth offerings to transform the way we connect with patients and consumers. This is some great data that I want to share with you. Before COVID-19, we were offering online urgent care, video visits, and other ways with connecting patients that did not require an office visit, but it was only in a few of our practices and outpatient locations. We now have video and phone visits across all of our medical group and behavioral health practices, and these account for more than 50% of all of our visits. We have also started video consults for physical therapy as well as inpatient consultations within our hospitals to reduce in-person contact when appropriate. In all, we have provided more than 35,000 visits by video between mid-March and mid-April. Compare that to roughly 50 the month before. The age of our patients have ranged from 4 days old to 98 years young for these video visits. Just to put it in perspective, in all of 2019, we completed 1,900 video visits in WellSpan. In the month of April, our daily average was 1,900 video visits per day. So we went from 1,900 in a whole year to 1,900 a day. We've also heard from patients experiencing serious medical issues outside of COVID-19, which include behavioral health concerns. Some of these patients are choosing not to come to the hospital for care over fear of contracting COVID-19 within the building. I want to reassure everybody, we have put in rigorous safety measures at our hospitals remain safe places to seek care for emergency conditions. Do not delay care for emergency conditions. Please call 911 or go to the nearest emergency department immediately if you have a life-threatening condition. We know many of you are impacted by the operational changes of our organization and others, in addition to the changes that you've made in your daily routines. It is certainly a time for innovation and new possibilities that will serve our communities well beyond the pandemic. I want to thank all of you for what you're doing to support our friends and neighbors. Now I'm going to turn it over to Maria Royce, who will discuss our work in the community. Maria?
Hi, everybody. It's good to be here with our volunteers today. I'm Maria Royce. I'm one of the senior leaders at WellSpan who have had a chance for many years to work with Christy and the team on our volunteer program and all that you do. And I want to express during this time how grateful we are for your support, your continued cheering on and support during these times. I also, like Dr. Goedeker, are at home, and I counted, I looked at the days before I got on this webinar. It's been 77 days that I've been working at home. I'm a pretty social person, so that's hard. And I'm imagining some folks on this call are feeling that same way. Dr. Goedeker mentioned some of those behavioral health resources and coping resources, be sure to check out the WellSpan website because there's some really great videos and really great support out there. So we have, I thought maybe what I would do is highlight some things as part of the WellSpan family. I hope that you're feeling as proud as many of us are feeling about WellSpan's response to this unprecedented time and pandemic. You've heard a lot of the great news that Dr. Goedeker shared about our clinical services and how we've responded, but we've also taken pretty quick action to work with our communities and really think about all of the needs and issues that might exist. And I thought I'd just give you a couple of examples of that. We do community health initiatives, community outreach, and community partnerships. And one of the things that we did to really slow that spread and flatten that curve, which we've all been successful at doing, is sharing our community partnership grants with community organizations. And let me just give you a couple of examples. We provided grants of over $82,000 for partners to provide meal delivery and pickup for individuals who were food insecure. We provided $64,000 to shelter the homeless through 8 different social service partners. And we actually worked on those protocols to ensure that should there be an infection, that individuals would have a safe place to go. Over $71,000 to help 11 partners keep their employees and their clients safe with increased sanitation, infection control, and equipment, personal equipment, and over $28,000 to provide partners with technology. So many of that telehealth services that we're doing, we're supporting others to do that as well. You may have read, I hope that for those of you who are on Facebook or LinkedIn or Twitter or any of these social media platforms, that you're watching the stories because we're trying to share a lot. But we have, the community has really been incredible, and there have been so very many partnerships. We partnered with local businesses to develop supplies and equipment manufactured in our communities. So when we found that some supplies would be in shorthand, we reached out locally and have developed local resources around that. Local distilleries early on helped our pharmacists produce a steady supply of alcohol-based sanitizer product, which was really important. And local suppliers are also helping us replicate national innovations for our frontline workers. So plexiglass shields and boxes to act as another layer of protection between patients and our staff during certain procedures. We're doing a lot of adaptations to ensure we are really the safest. And maybe, this would be a good time to mention not a direct COVID or coronavirus issue, but really relevant to this time. Earlier this week, we announced that we had received a pretty prestigious national award. It was called the Eisenberg Award for Quality and Safety. We were recognized, it's one of the most prestigious quality and safety awards in the country. First organization in Pennsylvania in something like 15 years to receive it. We received it for our work in sepsis, but it really goes to show this organization's commitment to safe and quality care. And as many of our communities have called our caregivers heroes during this crisis, what I think of, when I think of them as everyday heroes, because we, like you, get to see the great work that they do. So I just wanted to mention that. We've also been hosting this series of webinars. We've participated with our Chamber of Commerce's, our legislators, employers, skilled nursing facilities, social service leaders. We know that as a health system, the largest health system in the region and the employer, we have the ability to share information, be transparent, and ensure our communities have the resources they need to address safely the concerns that we have right now. In addition, I thought you might be interested in some of the other volunteers that have come forward at this time, and that's our active or retired physicians. We've had over 160 active or retired physicians and clinicians and nurses come forward and ask that question of how can I help during this time. We've been just so grateful for all of that. Now, I know Christy has some comments a little bit later about volunteerism. And, you know, one of the things that our workforce, our clinical teams are asking is, when can we get back to normal? And, you know, how I think about this is we probably can't get back to the normal that we all know for some time because we have some work to do to make sure that our communities and our facilities and everything else is as safe as it could be. But we are beginning to plan for what the next looks like and what the next normal looks like. And as we do that planning, I would say that one of our number one principles, and this is our boards, our executives have named this, and that's the principle of safety, making sure our patients, our caregivers, our workforce, and all of you, our volunteers, are safe in whatever that next normal might be. So a really important concept going forward. I think where I would end my comments is by just saying that outpouring from the community has been really important and will really support us in helping us on what is next as well. And I was thinking this morning, I was looking at a report, and you may be aware, and I know some of you have helped us with this, that we issued and became part of the 1 million mask campaign across the United States, because we knew that to be safe, not only do we need our providers to wear masks, but we need our patients to wear masks as well. And I will tell you that in just, under a month, 75,000 masks have been made. And those masks are being used in our facilities, and they're being distributed to community groups, ambulances, skilled nursing facilities, and so on, who could use those as well. So I think that's just the evidence, one little example of how we all work together, and that trust we just don't take for granted. So to end, I would say we miss you. We miss our volunteers, but what's more important than having you beside us while we're at the height and dealing with this pandemic is to have you safe and well. And that makes us feel great as well. So thank you so much. And I'll turn it over to Kristen Voigt now. Kristen?
All right. Good morning, everyone. My name is Kristen Vogt, and I'm the Director of Development for the Gettysburg Hospital Foundation. I work with the Greater Philanthropy team here at WellSpan, and on behalf of the philanthropy team, I really just want to thank you for your time and support of WellSpan Health in your role as a volunteer. Like Dr. Godecker and Maria, I too am at home this morning working from my house, so hopefully we don't have too many noise interruptions for me as well. This morning, I just want to give you a brief update on our response related to COVID-19. Like many other departments at WellSpan, philanthropy has needed to pivot quickly in the last few weeks to align with an outpouring of response and interest from donors and the South Central Pennsylvania communities during this pandemic. You heard Maria talk about the community support, and I want to expand a little bit on the response you've seen. Early on, we saw the community reach out to us, wanting to help with supplies, food, handmade masks, and more. And we realized that we really needed a centralized process and approach to help coordinate these acts of kindness and gratitude from the community. And so with the help of many colleagues, we developed an I Want to Help website on WellSpan's homepage that you can find at wellspan.org/COVID-19 help. Again, that's wellspan.org/COVID-19 help. And so through this website, there are so many ways that you can support WellSpan, and the community has been doing this. We've received 800 requests from individuals and businesses wanting to support WellSpan during this time with in-kind donations and monetary donations. And I just want to give you a brief snapshot of some of the ways our community has really made a difference, because it's just been really remarkable. You heard Maria talk about the handmade masks, and we're so grateful for the handmade masks that we've received. We also have handmade mask kits available for community members who want to make masks for us, but really struggle to find the resources to do so right now. So you can pick those kits up at one of our drop-off locations. And those are the drop-off locations are listed on our COVID-19 website, the help website. And so feel free to take a look at that if you have interest in making masks for us. We've also received like 44,000, I think, N95 masks, 100,000 face shields, 1,200 boxes of gloves, more than 500 cases of supplies, including items like hand sanitizer, hand soap, gowns, paper products. Our community has also reached out wanting to send messages to our care team, and we're calling these messages of hope. And these messages have been displayed on sidewalks and yards, in front of hospitals, and sent to staff as e-greetings and mail. Another thing that we've received, and Christy is quite aware of this, is we've received so much food, donated food. We've received gifts of coffee, healthy meals, fruits and vegetables, energy drinks, snack foods, pizza, Girl Scout cookies. The list could just go on and on with all the food we've received. And it's just been amazing to see the food kind of flow through our doors, and it's really fueled and given that lift to our teams during this time. So we've just received an outpouring of support in so many ways, and we're just really grateful for the community for cheering us on and helping inspire our care teams during this time. In addition to our in-kind donations, WellSpan has also implemented a series of community fundraising campaigns as a response to our COVID-19 work. And we've used social media like Facebook and e-appeals to help raise money for some of the pressing equipment needs for our caregivers and our patients. And we also sent out a direct mail letter to our donor community, inviting them to consider a gift in honor of our healthcare heroes at this time during the COVID-19 emergency. So again, this fund that we've created is to help with equipment needs as well as emerging needs across the healthcare system as we continue to keep our entire team and patients safe. Should you or your family like to consider donating to this COVID-19 emergency fund, you can visit our wellspan.org/COVID-19 help website to make a gift online. And we also have some instructions on where you can mail a check too. So in closing, I really want to thank you. Thank you so much for your time, your support, your service, and thank you for being a great neighbor here in South Central Pennsylvania. Christy, I think I'll turn it back over to you.
Hey, thank you, Kristen. Thank you to all our speakers today for sharing all the work and support that has occurred during these difficult times in each of our communities. We appreciate everyone being available today for our Zoom meeting. So I hope, as I mentioned earlier, I hope that all of our volunteers are doing well and staying safe. I know many have asked about, I thought I'd share a couple of updates about what is happening with the volunteer engagement team. We are all doing well and we're safe. We may have a little bit of Zoom meeting fatigue, I'm calling it, because we spend a lot of times on Zoom meetings like this all day, but the team is doing very well. You can see I'm in my office. The team has been going to their offices, every day. So we've assumed a lot of additional responsibility since the pandemic started. You'll find that many of us can be found in our incident command centers, and assuming additional roles as far as Kristen mentioned with donation coordination, as well as food. And then also coordinating all of those messages of hope that are coming in from the communities too. So the support from the communities has been very overwhelming, and it has been a lot to coordinate and manage, but the volunteer engagement team has been doing that very, very well. As far as I know, Maria mentioned, I know many of you are wondering when you can get back, and trust me, we want you back as soon as possible too. But know that, as everyone has mentioned, it's important that we keep safety at top of mind when we're planning for your return. Plans are underway for your return, but we're going to go back to safety each and every time for that return. Volunteering is going to look pretty different than it did before COVID-19. So we must be very thoughtful in our approach of your return. No matter what the return plans will be, it's going to include a lot of additional safety measures, such as new mandatory training and wearing masks at our facility, just to name a few of the changes that we're going to have. We hope to have more information in the coming weeks about when WellSpan may be able to resume some of our volunteer assignments. It'll probably be a tiered approach, but once that plan is ready, we'll let everybody know. We are just as anxious to have you back as each of you are undoubtedly ready to return as well. As I've mentioned before, and all of our speakers have mentioned, your absence has been felt throughout our organization. I want to thank each of you, our volunteers, for your continued support in the WellSpan communities. We have a lot of volunteers sewing masks, so that's great. We have a lot of volunteers that are donating to our COVID-19 campaign that Kristen mentioned. And really, what we need you all to do is stay safe. That's by staying home, practicing social distancing, washing your hands a lot, and wearing masks when you leave your home. We know that is not easy, but it's a really important job for all of you right now too. So with that, I know that we may have received some questions. So we will be sure that when we send this recording out, so that you can watch it again if you'd like to, and we'll share it with all of our volunteers, we will respond to some of those questions. So at this point, this concludes our webinar. I thank everybody for taking the time to spend this little bit of time with us. And hopefully we can plan maybe another one of these in a few weeks. And I just want you to know how much the entire volunteer engagement team misses all of you. But we want you to stay safe and stay well. So thanks, everybody. Have a super weekend, and we hope to talk to you soon. Thank you.